Very good afternoon, ladies and gentlemen. Selamat petang. Vanakkam. This is Malaysia. We have to speak all the languages. Today, natural healthcare medicine. Together with us, supporting us, giving us inspiration, guidance, encouragement. Specifically, I want to mention my brother from the great African continent, His Excellency from French Guiana, and his wife, she's also a doctor, for coming here as very special dignitaries to support, to grace and inspire us. Because we know Africa is going to explode soon. Not explode in terms of catastrophe. They are going around the world and they are going to show what they can achieve. Thank you very much, Your Excellency, for coming with your wife for this. Together with that, we have a special people, Dr. Aziz, an old friend, representing the Federation, Federation of Complementary and Traditional Medicine, and a newfound friend, Dr. Saib. I consider him representing the integrated medicine fraternity. And Dr. Lai, 1.2 billion Chinese, is representing the Chinese people in this conference. Of course, I have to also thank the Secretary General of MNP, who is also seated there, Tuan Friza, my good friend, close friend, working with me many years. And she, with my two brothers, so just now, K. Chandran and the other one, Balan. They all look very young, but they all retired many years ago, but they are still playing badminton with me together. So they are actually showing how healthy they are naturally. Now, without the presence of the participants and others, this conference will not be successful. I thank each one of you, whether from all the medical colleges and universities who have come here, practitioners, healthcare providers, people from the industry who have come for promoting their products and services, supporters from all fields, including homeopathy, reflexology, acupuncture, massage therapy, and we have about 7 countries representing this first conference. So, this conference is a landmark event in the progressive development of modern truth-driven healthcare and healing system. I have specifically used the word truth-driven as opposed to evidence-based, because evidence has got good evidence and bad evidence, but when it's truth, it is more appropriate because it depicts reality better. The contents which are being presented at this conference has been based on more than a decade's research and development work conducted largely by the Department of Research and Study at AK Pharmacy and Naturopathy Center. I'm sorry that most of the papers are based on our studies, but in future, when we have this conference, we are going to call all types, all modalities, leaders in modalities, researchers in these modalities to come and speak. And I've met a lot of new friends, so they are going to come forward and they will be speaking actively in the next conference. The papers presented elucidates the epistemology of modern natural healthcare. Epistemology means the theory of knowledge, natural healing, and to some extent, integrated therapy. In this conference, among others, the natural remedy for dengue fever and dengue hemorrhagic fever is formally declared. Later at the conference, we will be presenting it to the Deputy Minister or his representative officially, and also to the media. We are going to the full text later I will show in my dengue presentation, the research paper with the method. This work on natural healing remedy for dengue fever was developed at the Department of Research and Study using outcome-driven real-time method of healing, which to the best of our knowledge is the best protocol to study healing outcome of remedies. In this protocol, the human being is treated with the reality that each one is unique both genomically and in their lifestyle. The comprehensive documentation on the healing power of highly active micronutrient formulas for dengue fever and dengue hemorrhagic fever with irrefutable truth as its evidence is presented in a research and study which spans a period of 7 years, covering hundreds of patient case reports and systematic studies conducted with private institutions of higher learning. MSU, we have many studies with compelling truth-driven evidence, the great confidence that dengue fever natural remedy is declared here, and the fraternity of medicine together with regulatory authorities are courteously challenged, invited and urged to conduct studies to endorse the remedy or prove it otherwise. Either you study and prove it wrong, or you study and endorse it. Don't let it hanging. Let it hang like that for a long time. Okay. Malaysia must be proud that it has developed its own native or indigenous remedy for dengue. This is something we must be proud of. You all can go and check all the documentations. In this conference, the national healthcare system is rigorously assessed, both in terms of truthfulness of its philosophy. You will see when I am going through that. Since the quality of remedial outcome it has achieved for the healing of diseases, we are selecting diabetes mellitus type 2 as the illustrating disease. We have naturopath Vasanta Kumar who will be going through diabetes thoroughly, but I will, in my following presentation, use diabetes as a case to illustrate about our healthcare in Malaysia. Sadly enough, Malaysia ranks #1 in that genomic lifestyle disease called diabetes, with 14% of the population having diabetes, and #1 in the world. At this conference, it is being made clear, very important statement here I'm making. It is in this conference, we are making it clear that Malaysian healthcare system is essentially modern allopathic biomedical system. We have to be specific, not just say it's a healthcare system. No, it is. It is not a healthcare system where the various abounding healing systems, be it traditional or alternative, are scientifically integrated to provide a holistic, proactive healthcare and healing service. It is ironical that the Ministry of Health seems to accept the idea that allopathic medicine can regulate the health system, which their syllabus does not teach. Specifically, the ontological aspects of the human being, the energy and the mind, is not in the syllabus of MBBS or MD. It is emphatically stated in this conference that the country health plan, which I will go through later, for the 10th Malaysia Plan spanning 2011 to 2015 is essentially an allopathic plan. This is the point. It's essentially an allopathic plan and not a holistic, natural, health empowering and healing service plan. We are actually confused. We think that the Ministry of Health covers everything. No, it is Ministry of 80 to 90% allopathic health. This can be justified by the fact that all those involved in the preparation of the contents of the plan are allopathic doctors and allopathic related officers. No alternative medicine or natural health care or wellness expert were involved in the development of the plan. We put it clear that the Malaysian healthcare plan is not holistic enough, not complete enough, because it does not take into consideration the various alternative and traditional healing services that are provided at various levels in Malaysia, from the Kampung Bomo, Dukun, Pawan, to the Indian healers, traditional healers, and organized complementary medicine people have been not seriously taken into consideration in the 10th Malaysia Health Plan for Malaysia. We feel that plan is not complete. The conference will also witness the presentation of truth-driven clinical case stories, not case studies alone. Case stories means it will cover the feelings, the environment, the conditions surrounding the patient, not just his body and the medical condition alone. More holistically, covering aspects of 3 aspects of life, that is energy, mind and body, coupled with the ecological interconnectedness of both living and non-living entities. Clinical case stories include HIV/AIDS. In this conference you'll be seeing and witnessing cardiovascular diseases, diabetes mellitus type 2, pulmonary fibrosis, renal failure, SLE and dengue fever. We have chosen these topics because we have sufficient documentation on that. Papers on education, training, advocacy of modern natural medicine are presented. Coupled with a highly active micronutrient formula that is used in the safe prevention and healing of diseases where allopathic medicine is yet to find a solution. Various clinical documentation, reports, case studies and articles that elucidates the philosophy, concepts and principles of modern natural medicine are displayed for the perusal and purchase for those healers who have an earnest desire to study and develop modern natural medicine. You can see at the corner there, a lot of books, articles, case stories, documentation. It is the hope of the Malaysian Association of Natural Medicine Practitioners that this conference will be the stepping stone for further progressive transformation of medicine into a safe and effective system for non-invasive management of diseases with a proactive, forcaring natural healthcare system where some of the major philosophical and iatrogenic weakness of modern allopathy is addressed and solutions presented. We wish each and